Let's get to the vax fight and the politics around all of this today. Look, my genuine belief is that essentially in the places that really need the vaccine, bookings are being filled. People can turn up. No one went without a vaccine this week or last week because of different types of arrangements. But I have to play to you the comments of Daniel Andrews giving you a rip in the past couple of days. Roll the tape.
What I didn't know was that Premier Berejiklian's in a sprint while the rest of us are supposed to do some sort of egg and spoon thing. No, we want our fair share. These allocations, which are totally unfair and were under the table, need to stop, and we need to get a make good. We need to get those doses that we didn't get fast-tracked to us.
Why is he wrong, Minister?
Well, for a number of reasons. Firstly, because Victoria received 300,000 emergency doses when they had a crisis. The very thing that as humans we should be doing, focusing on the need where there's the equivalent of a flood or a cyclone, where there's real tragedy and real hardship. That's exactly what we did with Victoria. We've done that with the Northern Territory. We've done that with Bring Forward for Queensland. And we've also done it with New South Wales. In fact, Victoria as a government has received more per capita slightly than New South Wales. Equally, in terms of the primary care, New South Wales has had more, but that's overwhelmingly to do with uptake of AstraZeneca by the public. And then, in addition, we also recognise, as we've talked about publicly, the need to support people in extremis. What that's done is save lives. And so it's the right thing and the human thing to do. But we've supported all of those states that have had those crises. We provide per capita, and then with the emergency support on top of that, everybody's received their full allocation. And they're the really important things, that we're taking care of people, we're providing the vaccines. And magnificently, Australia has now vaccinated more than its own full population, the equivalent. So we've done more than 21.5 million vaccines. We're at this point in time 64.5% of the population that's had a first dose. We've had more than 8 million second doses, and extraordinarily, over 89.5% of people over the age of 70 have stepped forward to be vaccinated. So that's what's saving lives in New South Wales right now, but it's also why we prioritised emergency vaccines for Victoria in June. Every Australian has the opportunity to be vaccinated, and that's what we've fought for since the start of the pandemic, working to find as many vaccines as possible, as early as possible. And that's exactly what's happening now, and Australians are doing a magnificent job.
Now, about that rollout and different areas, and I understand urgency changes depending on what was southwestern Sydney weeks ago versus what might be either western parts of Melbourne and all the rest of it that's taking place right now. On top of that, Indigenous issues in regional communities. So there's many hotspots and flares that need to be dealt with here. But the arrangement with Poland, was that something specific to New South Wales, or that has been twisted in Labor talking points today?
No, in fact, the only reason we were able to get the doses was because of the outbreak in New South Wales. The Prime Minister engaged directly with his counterpart, the Polish Prime Minister. And this arrangement came about and was predicated because they saw that now we were in a situation where there was a genuine outbreak. The fact that Australia this year hadn't faced that, and now was, actually swung the agreement with Poland. I know because I worked with the PM right through this, and what mattered to the Polish PM is that, in turn, these doses, approximately half of them could be prioritised to the emergency outbreak, the other half on a per capita basis for the rest of the country. And that was the agreement. And that's the only reason we were able to get the agreement, because it was about saving lives in an emergency situation.